Lassa fever. Lassa fever is viral illness that occurs in West Africa. The reservoir of the Lassa virus is a rodent of the genus Mastomys known as multi-mammate rat. The Lassa virus is transmitted to humans mainly through food or household items contaminated by infected rats' urine and feces and by handling infected rats. Geographic distribution of Lassa fever. Lassa fever is reported in Benin, Cote d'Ivoire, Ghana, Guinea, Liberia, Mali, Nigeria, Sierra Leone, and Togo. Endemic in rural areas of West Africa. 58 million population at least. 100,000 to 300,000 estimated number of Lassa fever cases in West Africa each year. 5,000 estimated number of deaths in West Africa each year. Lassa fever transmission. Reservoir Mastomys rats. The virus maintains itself in Mastomys rat population. Virus is presented in urine and feces of infected rats. Primary human infections. 80 to 90% of humans are infected through food or household items contaminated by infected rats' urine and feces. Direct contact while handling Mastomys rats' food source. Secondary human-to-human infections. Secondary human-to-human transmission occurs through direct contact with the blood, secretions, organs, or other body fluids in infected persons. Clinical features of Lassa fever disease. The incubation period ranges from 5 to 21 days, with 80% asymptomatic and mild symptoms presentation. Overall case fatality rate, CFR, is 1%. CFR can reach 15% or more among patients hospitalized with severe presentation. Most common symptoms include gradual onset of fever, malaise, and general weakness. After a few days, headache, sore throat, muscle pain, chest pain, nausea, vomiting, diarrhea, cough, and abdominal pain. In severe cases, patient may present with bleeding, neck, facial swelling, and shock. Sequelae, various degree of deafness have been shown to occur in 25% of survivors. Hearing return after 1 to 3 months in only 50% of these patients. Particularly severe in pregnant women and their fetuses. Fatal death rate greater than 85%. Increased maternal mortality in third trimester greater than 30%. Significant cause of pediatric hospitalizations in some areas of West Africa. Infants up to 2 years old can present a swollen baby syndrome and is associated with high case fatality rate. Lassa fever diagnosis. Symptoms are non-specific. Clinical diagnosis may be difficult. Differential diagnosis includes other viral hemorrhagic fevers, yellow fever, malaria, typhoid fever, shigellosis, and other viral and bacterial diseases. Patient history is essential and should include exposure to rodents and or area village endemic for Lassa and or contact with Lassa cases. Lassa fever laboratory diagnosis. Definitive diagnosis requires testing in reverse transcriptase polymerase chain reaction, RT-PCR assay, IgG and IgM antibodies enzyme link, immunosorbent assay, ELISA, antigen detection test, virus isolation by cell culture. Lassa Fever treatment. Intensive supportive care including monitoring fluid and electrolyte balance and renal function, careful rehydration. Supportive drug therapy including painkillers, antiemetic for vomiting, anxiolytic for agitation, antibiotics and or antimalarial drugs, antiviral drug ribavirin can be given early in course of the disease. Community engagement and awareness. Engage with communities to promote desired health practices and behaviors, including environmental hygiene and food consumption. Provide accurate and timely health advice and information on the disease. How can I prevent getting infected with Lassa fever? 1. Wash your hands regularly. 2. Store food in containers with lids. 3. Keep your home clean and tidy to discourage rats from entering. 4. Keep a cat. 5. Cook all foods thoroughly. Reducing risks of rats to human transmission. Prevention relies on promoting good community hygiene to discourage rodents from entering homes. Removing source of attraction for rats, storing grain and other foodstuffs in rodent-proof containers, disposing of garbage far from the house, and maintaining clean households and washing these after eating. Preventing rats from entering house, black holes around the house, improving building materials and structures, ceiling, walls, and keeping cats and dogs. Avoid contact with infected rats and consumption of their raw meat. Rats should be handled with gloves and other appropriate protective clothing. All animals' products should be thoroughly cooked. Reducing human-to-human transmission. Avoid contact with infected Lassa patients and deaths. Regular hand washing with soap and water. Encourage early treatment in Lassa treatment center. Hand washing using gloves and masks when caring for suspect Lassa patient at home and seek for health advice. What do I do if I think I have Lassa fever? 1. Avoid contact with other people. 2. Seek health advice immediately. 3. Drink plenty of fluids. 4. Ribavirin and antiviral drug can be effective treatment if given early. Research and development for Lassa fever. Close to patient diagnostic tests are in late stage of assessment. Candidate drugs are in early stage of testing. Vaccines are in develop. Affected countries are at the heart of R&D product development. That's all. Thank you.